And good morning. I'm Mike Hart. Thanks for tuning in to 23 ABC. We interrupt this programming to break into the live press conference being held by health department officials currently to discuss the latest number of COVID-19 cases. Let's join Megan Person, the PIO for the county, as she begins her opening remarks.
Before I bring our Director of Public Health up, I'm just going to do a quick update on our testing sites to give you some information. We haven't gone through these details in a while, so I am going to reiterate some things. Currently, through the county, state, and federal sites, we've conducted 40,457 tests, which makes up about 30% of the testing total. At our federal surge site alone, we've conducted 2,925 tests. We've also tested through our mobile farm workers testing program, 76 people. And now for a quick update on the sites. The federal surge site is located at the Kern County Fairgrounds. It's open 7 days a week from 7 a.m. to 7 p.m. We have actually secured an extension on that site. It was set to close this Sunday. So starting Monday, we will start a new 12-day extension of that site. So again, that's 7 days a week, 7 a.m. to 7 p.m. I want to reiterate that this site is really helpful for those of you who are asymptomatic and still want to get tested. There are some labs that prioritize those who are symptomatic or who have been identified through contact tracing, and their labs get processed first. So this is ideal for those of you who may be asymptomatic, and they still are saying that their process and turnaround time is 3 to 5 days. You may experience a longer time at another site. The state-provided sites remain open and functioning, so you have a site in Arvin at the Old Public Health Building, at the Wasco Library, and the Rosamond Library. We encourage you to use those if you're in that area. There are also county-provided sites available at the Good Samaritan Hospital in Oildale, the Westside Healthcare District in Taft, the Adventist Health Delano Regional Medical Center in Delano. Kern River Valley has the Kern Valley Hospital. Tehachapi has Adventist Health Tehachapi Valley, and Lamont has a site at the Kern County Library. Again, we encourage you to use those if you feel like you need to be tested. They are free, and all of that information can be found on the county's website, kerncounty.com. There's a large button on the front, and you just click on that. It comes in both English and Spanish. If you need that, we encourage you to look it up. Now I'll bring up our Director of Public Health, Matt Constantine.
Thank you, Megan. This morning we are announcing 291 new cases of COVID-19 in Kern County residents and no additional deaths. We've spoken about the state's database before. It's called CalReady. This database that the state maintains is where all of our lab results go into and then get distributed out by county. The state has notified the counties that this database is struggling and has had some issues moving data to the counties. So although we're grateful that our numbers that we have been reporting out have been lower, we are concerned that those lower numbers are attributable to the state's database not properly working. They've indicated to us that as of last Friday and going forward even as of today, that database is not properly functioning, and we would likely expect additional cases that would be attributed to counties, and in particular Kern County, in the future. They don't know how many, and they don't know when it'll be fixed, but many of those lab results that are going into the system are not coming out. In fact, we were told that our two largest labs that are used locally, Westpac and Quest, are no longer even submitting to CalReady, and that presents obviously some concerns to us. So we're awaiting further guidance from the state, but currently that system is not properly working. We've been talking more and more about ICU beds. We had spoken about this previously, but we track this data very closely. Many of our metropolitan Bakersfield hospitals, acute care hospitals, are either at or above their licensed ICU beds. Adventist Health Bakersfield is above. Kern Medical is above their licensed limit. Mercy Southwest and Mercy Downtown all exceed their licensed beds. That is a concern, of course, to us. This is what we have been preparing for some time. Recently, the Board of Supervisors approved a new agreement to allow us to provide more than 80 ICU nurses that are distributed out to our large acute care hospitals. Those nurses are now arriving and now being assigned to one of these hospitals to help staff up additional ICU beds. And then in addition, the state has provided a number of medical teams that are deployed locally to help with imminent staffing shortages. So we have several teams in Kern County, Kern Medical, Adventist Delano, Adventist Bakersfield, Mercy, and Memorial all have state deployed teams that are present today assisting with the increased patients at those hospitals. So that work continues, and we continue to monitor that very closely. And then finally, personal protective equipment always remains of interest to our hospitals. We put in a large order recently. We are now going to distribute 22 pallets of PPE to each of our 10 acute care hospitals. So each hospital has been assigned 22 pallets of personal protective equipment. We're hopeful that that's going to help for a long period of time so that they are well equipped and ready to respond. With that, I'm going to introduce Dr. Chris Lyon, our health officer, so he can provide some comments.
Thank you, Matt, and good morning. I just want to speak a little bit more about our efforts together to battle the coronavirus pandemic. It's extremely important for all of us to do our parts to try to stay healthy. So there are certain things that increase our risk for outcomes, such as diabetes, high blood pressure, smoking. So it's extremely important to continue taking your medications for your chronic illnesses, as well as to exercise, eat healthy, try to stop smoking, as well as decreasing alcohol intake. We also want to continue to remind you to do your part and stay physically distanced and to wear a mask at all times when you're around other people. Thank you very much.
Good morning, everybody. I'm Ryan Alsop, the Chief Administrative Officer for Kern County. Since the beginning of the pandemic, nearly 133,000 people have tested for COVID-19 in our county, and to date we've had 21,724 residents who've tested positive, 21,306, or about 98% of whom have either fully recovered or are currently isolated and recovering at home, treating their symptoms on their own. Today we have 266 of our residents representing just over 1% of the total number of positive tests who are receiving some form of care in an area hospital. Fortunately, we have lost 152 people since the beginning of the virus's spread in our community, which represents just under 1% of the total number of those who have tested positive in the county. On hospital beds, we currently are reporting 530 regular hospital beds that are available throughout the county, with 40 available ICU beds. A little bit on the Kern Recovers program, the forgivable loan program to small businesses. A total of $30 million has been pumped into the local economy by the county over the last 2 months. This money has gone to 940 small businesses across 255 industries with an average loan amount of just over $30,000. And that program has hit its capacity with the money that has been set aside, and we look toward and forward to potentially pumping more money into that program in the weeks and months ahead, because we believe that it is an important part of dealing with COVID in our community. The other part of the Kern Recovers program is our personal protective equipment, or PPE, distribution to area small businesses. We have 16 distribution points throughout Kern County. We are giving small businesses 2 weeks supply of PPE. To date, we've had 721 small businesses throughout our county receive this equipment. This represents businesses across 70 different industries, impacting nearly 12,000 of their employees. So we're pleased with this program. This program will continue to be ongoing, and you can track our progress. You can track who is receiving this personal protective equipment. Small businesses, if you are a small business here in Kern County, you can fill out a simple application and schedule your pickup of these supplies of PPE for your employees by visiting kerncounty.com. Again, we have said this the past couple of weeks, and I'm going to say it again, and I will continue to say it as we have these press conferences each week. One of the most important aspects locally in medical care and treatment at any time, whether it's during a pandemic or not, is blood donation. It's always important to donate blood, and it's important for all of you to know that your donation of your blood at any time saves lives. During this pandemic, however, the need for convalescent plasma donation is critical. For those of you in our community who have contracted COVID-19 and have recovered, and there are thousands of you, please donate your plasma. Your donation will save lives for those in our community critically impacted by this virus. These are the people that are in the hospital receiving acute care. These are the people fighting for their lives. They need your convalescent plasma. This week, Kern County, along with the Houchin Blood Bank, has begun an aggressive effort to contact the thousands of you in our community who've tested positive to encourage you to get out and donate your plasma. We need your help again. You again can save the lives of your fellow residents in this community. Please consider donating. You can do this today by calling Houchin Community Blood Bank's Convalescent Plasma Hotline, and that number is 661-616-2575. Again, that number is area code 661-616-2575. And obviously, you can go to Houchin Community Blood Bank's website. You can also go to kerncounty.com to get not only this number, if you weren't able to write it down, but also additional information on how you can go about being a hero in our community and doing us a favor, doing your fellow citizens a favor, and giving your plasma. With that, we're happy to begin the Q&A period.
Thank you, Ryan. As always, we'll go in the list that was given to our media outlets. I'm going to say this at the top because we do have one unidentified caller. I don't want to call out your phone number, but there is someone that we don't know which media outlet you're with. So if I miss your outlet and you're on the line, we'll come back at the end and make sure we catch everybody. Just like we did last week, we'll ask that each outlet ask their initial question. And if you need to clarify the response, we're happy to do that. However, if you have follow-ups, we ask that you hold them to the end so that our outlets who just have one question and have to get to their next story or have an assignment they need to get to, they have the ability to do that. Remember, it's *6 to unmute, and we'll start at the top of the list. The first one that we believe we have on the line is Channel 17. I think we have Aton.
Yes. Hi, Megan and Ryan. Channel 17, Eitan Wallace here, and my question is as following. You talked about the latest numbers, Ryan and Matt did. So the positivity rate here in Kern County and Central Valley, many consider are concerning right now. Dr. Birx at the White House mentioned she's concerned about the Central Valley. Are you concerned we're going to see an influx of cases on top of our already high number?
So the question, just to clarify, Eitan, what you're asking is whether or not we locally have concern that we're going to see an increase on top of what we're already experiencing.
Correct.
Okay, so we're going to have Matt respond to your question. Give us just 1 second.
Thank you.
Hi, Eitan. If the question is whether or not we're going to see an increase in positivity, we have no way to know that at this point. We know that testing capacity in Kern County continues to fluctuate, and that right now, with the current issues we're having with the state database system, we are not getting a lot of our lab results in a timely manner. We should mention that this does not affect the reporting that's going back to healthcare providers, and it is not affecting patient care, but the disruption is happening between the labs going into the state database system that are coming into the public health department. And so we don't have any way of predicting whether or not testing positivity is going to change. We know that without receiving these electronic labs, there's going to be delays in us at the public health department being able to get them onto our dashboard because we're having to enter everything manually. We are indeed focusing on dealing with positive patients first, and those negative labs may be coming in behind those positive results. And so we want people to be aware that our testing positivity is going to be fluctuating based on the manual data entry that's having to go on right now. Typically, when those things go in together and we have on any given day all of our positives, all of our negatives come through, then we have a pretty accurate picture of the testing positivity. Right now, we, as in probably most other counties in California, are going to spend the vast majority of our efforts to make sure our positive test results go into the system so that their their case investigations and contact tracing can happen as soon as possible. Those negative lab results may come in at a slower rate, and so we may see some pretty wide fluctuations in our testing positivity in the immediate future.
Thank you, Kim.
All right. Thank you.
Okay, I believe the next outlet we have on the line is the Bakersfield Californian. I think Teddy was able to get in at the last minute.
Yeah, I am here. I don't have any questions, but I hope everyone has a great day.
Great, thank you. We'll go on. Our next outlet is Kern Radio. I believe we have JR on the line.
Yeah, JR Kern Radio. I have a question about the 80 nurses that were approved by the Board of Supervisors. You said some are currently here. How many of those 80 nurses are currently here right now as we speak, working in local hospitals?
We'll have Matt respond.
JR, good morning. So the arrangement we have allows the hospitals to actually contract directly with the staffing company and obtain the number that we have allocated, up to that number that we've allocated, and then utilize them. So they're coming in. Today I don't have a count for you, JR. I'm sure I can get you a number. It is increasing. It takes them a while to secure those nurses and to ask them to move into Kern County for a while. So it's starting. I just don't have an accurate number, but I can certainly get you more information if you'd like.
Thank you.
Thank you.
Thank you, Matt. The next outlet we have on the line is Kern Soul. I believe we have Elizabeth.
Hi, good morning, Megan. It's Elizabeth. My question today is about the farm worker testing program. I was just wondering if you could go into a little bit more detail about how this program works. Is someone from public health going to the work site to do testing? Do smart markers sign up? And out of all of the tests that you've conducted, do you have a number yet on how many have tested positive?
Okay, so I think I can probably take the first half of this. So let me give you some details about the program. So we partnered with Good Samaritan Hospital to deliver this. They coordinate with the companies, the agriculture companies here in town who have employees who need to be tested, and they do that on a rotation. They work with a schedule that's convenient for the workers and depending on what they're doing on any one given day. So they move through the various agriculture companies here in the county. I think to date, I think we've tested 76. I don't believe we would have counts on how many of those are positive, simply because that's a little bit too detailed to identify, and would probably hurt the privacy of those involved. I'm checking with Matt to make sure. Yeah. So that, I think that completes the full answer to your question, but if you have more, let me know.
Just one follow-up. So the agriculture companies reach out to Good Samaritan, or Samaritan reaches out to the ag companies and they schedule based off that? Is that how it works?
I think it's a combination of all of that. So we obviously have knowledge of some of the larger companies and their operations, so we can reach out to them. Also, those other companies can reach out to us and let us know that they want us to come do the testing.
All right, thank you so much.
You're welcome. Okay, our next outlet that we have on the line is Mojave Desert News. Okay, we'll go to the next one. I believe we have someone from Mountain Enterprise on the line. Yeah, if this is your first time on the call, because I think this is, it's *6 to unmute, and then we'll be able to hear you. Okay, we're going to go on to the next one. If we need to, we can come back. Our next outlet is Valley Public Radio. I believe we have Carrie on the line.
Yeah, good morning. Can you hear me?
We can. Go ahead.
Okay, great. Yeah, well, I was wondering, I mean, as we grapple with these rising cases here in Kern County and elsewhere in the Valley, I mean, is there anything, well, basically, I mean, like, we obviously are addressing this every time that we have this call, but what do you think are the reasons that the cases just keep rising so much? I mean, is there anything that you think that there at the county that you could have done differently, or that you would have done differently if you were to go back? I guess that's two questions.
Yeah, Carrie, let me make sure I understand your question. It was kind of a bit garbled. So what you're asking is, given the number of rising cases, is there anything that we can identify that's led to that, and anything we should do differently? Am I catching that right?
Yeah, I mean, obviously, I know, like, the short answer is, you know, we've had a lot of, like, person-to-person spread, but I guess, like, yeah, kind of overall, what is the... Yeah, I mean, how did we get here to this point despite all of these public health measures that we've taken? And then, yes, are there any things that the county would have done differently going back?
Okay, thanks, Carrie. I think we're trying to decide who's going to answer that one. It's going to be Kim. Give us 1 second.
Hi, Carrie. Thank you. It's a really good and important question. The short answer is that we always expected cases to rise. You know, if this is, if COVID-19 is a truly novel virus, then most of us are going to catch it. We know, particularly in the very beginning of, you know, back in March when we started having our first cases in Kern County, that testing was very scaled back. It wasn't widely available. You had to meet very specific criteria in order to be tested. So we know that we were not catching all of the people at that time. As we've expanded testing capacity in our community, we've enabled more and more people to be tested so they can know about their status, they can take precautions, we can trace around them. And so I don't think it's a question of whether or not we ever expected to see more cases. We knew that we would continue to see it increase. We're hopeful at any given point in time that we will see it stabilize and decrease again, but we know that transmission is expected to go on. We want people to continue to take every effort to maintain the precautions that have been spoken about since the very beginning. Keep your physical distancing, wash your hands, stay healthy as an individual person, stay home when you're sick, avoid people who are sick, do all of those things to minimize transmission in our community. And so we do expect cases to continue to rise. We haven't seen it plateau here locally, but we want people to keep making those efforts and to keep doing everything they can to prevent transmission within their households, within their families, and throughout our entire community.
Thank you, Kim.
Okay, thanks. So there's nothing about whether. Well, so I guess you're saying that there wasn't anything you would have done differently.
I'm hearing that there's nothing new. I'm not sure if that answers your question.
Okay, sure. Thanks.
Okay, so our next outlet, I believe we had Norma from Telemundo join. Okay, and then there is also an unknown caller. If you belong to one of the outlets that we did not call, it's because we can't identify who you're with. So if
Hi,
there's...
can you guys hear me?
We can now. Go ahead.
This is Erin Roney with Channel 29. Sorry, I'm calling on my cell, so
That's okay.
I didn't recognize the
I
number.
figured it was either you or 23. So go ahead, Erin. I'm sorry.
No worries. I apologize. So I do have a few questions. I will keep them short. We are seeing an uptick in family spread. I'm just wondering if there's a known case where families are getting this. Something else is, do you feel that we are getting ahead of our backlog, or is this something we are unsure of at the moment because of Cal Ready, the lab results being delayed? And since we aren't sending our lab results to Cal Ready, where else are we going to be sending them? And my final question is, how many healthcare workers have been impacted by COVID-19?
Okay, so that was like three or four questions. So let me see if I can summarize that in a way that makes it possible for our experts to answer succinctly. The first question was about family spread, whether or not we're seeing an uptick in that. The second question, shoot, I think I may have forgotten the second one. What was it? I'm sorry.
No, I apologize. I know it's a lot. Just, do you think we're getting ahead of our backlog testing, or are we unsure because of the Cal Ready lab?
Okay, and then your third and fourth question were about the number of healthcare workers that have been impacted?
Yes, and then my third question was, is there a lab that you all are possibly thinking of using instead of Cal Ready?
Okay, just making sure we keep track of these. I think Kim's up to bat first, and we'll try and make our way through these.
Thank you.
So regarding the first question about family spread, we've known and we've seen since the very beginning lots of spread among close contacts, which includes families and households. It is very common for a first person to be identified in the household. For other people who are in close contact, often in a household, you eat meals together, and you're sharing bedrooms and things like that. And so we do see a lot of people who live together who become positive around the same point in time. The second question regarding the backlog of test results, we are unfortunately still seeing some test results that are coming back. Unfortunately, even 2 weeks after that specimen was collected. We know the labs have worked to increase the capacity, and they are testing as many as they can as quickly as possible, but we are still unfortunately seeing delays. If you are a patient and you are still waiting for your laboratory test results, please make sure that you're in contact with your healthcare provider or the community test site that tested you so that they can double check that they have not received that test result back. We do know that we're seeing significant delays. We've tried to help patients as they work through this. this, of what they can do while they're waiting for their test results. But unfortunately, that delay is still happening. We are seeing a separate type of delay currently with the state database CalReady having disruption to electronic laboratory reporting. And so even though some patients are hearing from their healthcare provider right away, they may not be hearing from us at the Public Health Department because of this disruption and the delay, because at the Health Department, we may not be receiving that test result for 2 or 3 days after the healthcare provider gets it. Some are coming back even later. And so we are encouraging our patients, if you are known to be positive, to reach out to us at the Public Health Department, to go online to fill out the case report form that we've put online to make it a little bit more convenient and a little bit more efficient for our community. You can navigate it to it from the kernpublichealth.com webpage. Click on the green coronavirus button. There is a green button on the COVID-19 webpage that says positive patients, click here. And then on that final page is a case report form that you as a positive patient can fill out at your convenience. It is both available in English and in Spanish. This will help us reach out to you quickly because we may still be waiting for your laboratory result to come into us. We are working with the state. The state is working very hard to get the system back online and to fix the disruption that we're seeing. But we know right now today that we are seeing significant delays in getting that reported to us at the Public Health Department, which of course impacts our ability to contact any of our cases and follow up with any of the close contacts. Question number 3.
So the third question was about healthcare workers and the number of healthcare workers.
So for healthcare workers, that we don't have a set number of healthcare workers where we are tracking. You can find out for our skilled nursing facilities how many positives they've had in skilled nursing facilities. The state puts that out publicly. We have not publicly released the number of healthcare workers who've been impacted in our community. And then that was it, I think.
Just my last question was, since you guys are trying to avoid using CalReady, is there another lab you all are thinking of directing result or tests to?
So CalReady is not a laboratory. CalReady is the California Reportable Disease Information Exchange. It's the state database system that the local health department uses to communicate with the state health department and vice versa. This is how we report all of our cases to them. A module in that system is electronic laboratory reporting. So instead of the laboratories having to fax off each individual laboratory report to the local health departments, it comes through basically an exchange process where they submit in batch format, and then those records, those laboratory reports get divvied out to the different counties of residence. That module right now with the electronic lab reporting system is down. It's dealing with some issues that they're working out at the state level. We have asked that our local labs report directly to the Public Health Department, anyone who was using that electronic system, so that we can receive those results in a more timely fashion. So we've been reaching out to those labs to ensure that we are still getting laboratory reports, but this, of course, is a entire operational change for those labs who have been using this electronic format for many years. So they are working through it. We are working through it. Everybody is working as hard as they can to make this communication as seamless as possible. Thanks.
Thank you for explaining that. I really appreciate it.
Thanks, Kim. You took the heavy lift on that one. Okay, so I think we've made it through all of our outlets that we have on the line. I'm going to open it up for any additional follow-up questions.
Yeah, this is Mike Hart from 23 ABC. Can you hear me?
We can. Sorry we missed you.
Yeah, that's all right. I wanted to touch on quickly a couple of things real briefly. Matt had mentioned the ICU beds at 266, I believe he said today, and that was sort of at a critical capacity. Back on July 25th on the dashboard, it listed the number of ICUs or hospitalized at 301. Now, is that all hospital beds potentially, or are all that are COVID patients automatically put into ICU beds?
So, Mike, I think there may be some confusion around the numbers. So we're making sure we have clear numbers for you, and then we can reiterate that. So you need the total number of hospital beds and ICU beds?
Well, no, Megan, I'm curious about if it's 266 today and we're at sort of like a critical level. It was 301 back on July 25th, and so we reduced by about 34 or 5. Did we have more beds then? Are there less ICU beds now? I just was wondering about if 266 today is considered pretty bad. We had 301 just 2 weeks ago.
Okay, we're going to have Matt respond to your question, Mike. I think we're also pulling data really quickly, so just be patient with us.
Sure.
Mike, good morning. So these are some confusing data points, and it changes all the time. So the state reports to us what the hospitals are reporting about how many COVID positive hospitalizations there are and how many COVID positive ICU beds that are being used. So those numbers change quite a bit every day, and you're right, they did come down somewhat. There is a lag between when the hospitals report to the state and when the hospitals report to us. We ask that the hospitals provide us data every 3 days, or Monday, Wednesday, and Friday. And then at times they may have more in ICU beds than they have licensed, so they go to their surge response. So those numbers vary and are dynamic. They're kind of managed individually by each hospital. So, Mike, I'm not quite sure I answered your complete question, and if I didn't, perhaps you could help me refine it or direct me otherwise.
Well, I was just curious when it says number of hospitalized people, like you said, it was 266. Is there a breakdown? I mean, are there people that are considered hospitalized and not sick enough for ICU, or if they're on that list, are they all considered ICU?
So, Kim, I think I'm going to defer to Kim to see if she could try to answer that. So hold on just one moment, and I think she's collecting data as we speak. And this, perhaps we could provide you a response later, I'm assuming. So, Mike, let's do that. Okay. Let us get you a better, more complete answer. Kim is trying to look up that information, and we'll give it to Megan, and then she can send it out.
If you could also, if you're as long as you're looking up, I know I have another number, and you just mentioned how the state data is sort of in flux. The other question I had was, as of today, we have 6,109 recovered patients, 6,109. Back on July 1st, we had 3,690. So that's an increase of about 2,400. Those isolating at home on July 1st went from 5,800 and changed over 15,100, a change of 9,300. So given that it's 34 days in that gap between July 1st and today, with the number of people isolating at home increasing by 9,300, but by recovering only down 2,400, I was wondering, what is the criteria for moving off the isolation list and onto the recovered list? Does it require more testing that has to go get reported somewhere else and then get back at some future point?
So, Mike, I'm going to ask Kim to see if she can respond for you.
Hi, Mike. So on our dashboard, what you see for people under that recovered column are those who have been released off of isolation. They've had isolation discontinued either at home or in the healthcare facility. We follow CDC's criteria for discontinuing isolation or transmission-based precautions in those settings. And so patients need to be at least 10 days from their symptom onset. It must be at least 24 hours since their fever has resolved, and they must have improved symptoms. There are some rare instances where that is different. That's the main criteria that is used. There are others that are available, and once those patients are assessed and are able to be moved from the isolated at home or isolated in the hospital category into the recovered, no longer under isolation category, they do get moved. We do know that go ahead.
Oh, I'm sorry. I was just saying that it's been 34 days since July 1st, and with almost, I can't even, I'm doing the math off the top of my head here. It's almost 7,000 people that, I'm just wondering if that number of recovered should be higher by now.
It probably should be. And so that's part of us also going through making sure the data on the dashboard is correct. We are also, we see a large influx of people, and some of those people are not going to be done in 10 days. Some people are symptomatic much longer, and so their time frame being isolated will extend because we do look into those symptoms. And so we are working to get that updated. We are focusing most of our case investigation and contact tracing attention on reaching out to patients, getting them educated, making sure they understand what the process is, and then we are going through and we are also making updates to our dashboard. So obviously those patients who were isolated at the beginning of the month or in the beginning of July, hopefully most of them have been released from isolation, and we are making sure that that information is reflecting on our dashboard. So we are trying to reconcile those things, obviously, and make sure that all the information we have in one place makes it to another.
Okay, and I apologize. I know that there's the confusion with the numbers right now coming from the state, but I'm just wondering if once we get all these backlog numbers put in, are they going to be put in on the date we get them? Are they going to be put back on the days that it actually happened? And how will that impact how long that businesses and everyone else around here that we're on this monitoring list? Will that extend the life of how long we're on that list?
So the short answer is to where do all of these patients fall in is everything on our COVID-19 dashboard is based on the specimen collection date. So that's how we count cases, because that is the earliest known date that a person was assessed and potentially infectious at that time. And so that's sort of the date that you see when we are counting cases. When we are releasing patients off of isolation, that number is effective the date that is put in. So if we find somebody who was released, who discontinued isolation yesterday, and we enter that to date, it will show up on yesterday's data as another person having been in that recovered category. So I'm going to let Matt answer the rest of it.
So Mike, your question about businesses, so the state's database failure will not affect our businesses now. The governor has indicated that once you're on the monitoring list for 3 days, then the governor's new restrictions apply. And so that has occurred already. Unfortunately, and unlike previously, the local success, our local success on meeting those metrics on the monitoring list no longer have relevance on allowing local businesses to open back up. The governor has indicated that once you're on the list as a county, you stay on the list, and the only way you come off is statewide. We do it as a state and not as a county. So those numbers, those numbers we're waiting for to come through the state database do not affect businesses today. Hopefully that answers your question.
All right, thank you.
Okay, I think we're on the follow-up questions, trying to make sure we keep on track. So do we have any other outlets with follow-up questions?
Yeah, JR Kern Radio.
Go ahead.
Yeah, follow-up from Mike's questions. Mr. Constantine had said something about only receiving data from the hospital every 3 days. I want to make sure I heard that right. And if so, why only Monday, Wednesday, and Friday? Why not every day? Especially considering where we are with our hospital numbers.
We'll have Matt respond.
JR, good morning again. So the state requires every acute care hospital to report daily bed polls, a daily number of the amount of patients and available beds. The state then provides that to us. We asked, with the hospital CEO's concurrence, to collect additional data. We were doing it once a week, and it was somewhat repetitive from the state data, but we felt it was more meaningful for us. For example, the state was including NICU's bed counts into their ICU count, which we didn't think was a true representation of what was available in Kern County. So we went from actually 1 day a week to 3 days a week. So this is above and beyond what is normally done, and it far exceeds the state standards, but we felt it provided additional helpful information to us to do it. So it's a lot more work for the hospitals, but we find it more meaningful. JR, hopefully that answers your question.
No, it did. Thank you very much for clarifying.
Sure.
Any other follow-up questions?
It's Eitan Wallace again with KGET for a follow-up.
Go ahead.
And I just want to make sure I heard Kim correctly, and I'm quoting here. To quote, she said, "Most of us are going to catch it." Did I hear that correctly? And are you able to expand further?
So I'm going to have Kim respond to her statements about what you may have heard. So we'll have Kim start.
Thank you.
Hi, Eitan. Thank you for clarifying. With any novel virus, the general assumption is that the entire population is susceptible, and so we are all at risk of catching COVID-19. We want to minimize that, of course, and I'm very hopeful that many of us will not catch it if we continue to do the things that have been recommended. So thank you for clarifying that. But when you talk about any kind of novel pathogen, what that basically means is if that means that nobody is immune to it, nobody's been exposed to it in the past, and so that we are all at risk of coming in contact and being infected by the virus that causes COVID-19.
Hey, much appreciated, Kim. Thank you for that. And just one more question, guys, just regarding state models. I know I've asked Mr. Constantine about this in the past. I know he actually addressed this at the Board of Supervisors on Tuesday. But how accurate are the state models now, and what's the Public Health Department doing with the model data?
Eitan, it sounded like you got cut off there at the end. Did you just say, what are we doing with the model data? Did I hear that right?
Yes, thank you, Megan. That's correct.
Okay, we'll have Matt answer your question.
Thanks.
So good morning. So yes, the state provided model, we are tracking along pretty closely to what was projected. And for months now, the model has indicated that ICU beds would be a concern for us towards the end of July. And that, in fact, has come true for us here locally. Now, the model shows that we are not going to peak until likely end of February, and really the cases don't subside, or the hospital admittance doesn't subside until late summer. Of course, it's just a model, and there's a lot of factors that can change it. We're actually optimistic that we can change it if we continue to do our actions and really do more to try to keep that disease from being transmitted. So it is surprisingly accurate so far, and we do look at it carefully, but it was a good indicator for us as to what we needed to do to prepare. And I'm grateful that we've had a lot of these steps in place because we find ourselves today in a challenging situation. Does that answer your question?
No, what Matt, it does. Thank you. And in terms of August, then, I mean, just in the following weeks, does the model indicate anything in particular, or is it just kind of going up?
So just going up. It shows a slow and steady increase heading up into early 2021, where cases will continue to rise. Our ICU hospitalizations will continue to rise. And that's where our focus has been. It's those ICU beds and needing to do everything we can to allow them to remain open and staffed and available for anybody that needs them.
Okay, Matt, thanks so much.
Thank you.
Any other follow-up questions?
Yeah, JR.
Aaron Roney here with 29. Oh.
Go ahead.
Yeah, just on something that Matt just said about changing the model in actions, and then he said more could be done. What more could be done? I know we're not enforcing the rules here as gyms and hair salons and kids' sports centers continue to stay open in defiance of the governor's order. What's more action?
Jerry, we're going to have Matt respond.
JR, so you're right. I think it's important to recognize that we can influence that graph and the number of cases in our hospital. So the first thing is what we are doing when we get complaints or are aware of an activity, meaning a gathering or a business that's operating, we track that information, we collect it at our call center, and we will send out a letter asking the business to review the guidance documents and to ensure compliance. If that's unsuccessful, we send a second letter reiterating the need to take action. If that is unsuccessful, we refer it to the state's strike team, where they have the ability to enforce the governor's order. And so those activities are ongoing. I think as a community, we need to do more. What the ICU beds are telling us is we're running short. And as Dr. Lyon has said and as Kim has said, we need to remember that this disease is here. It presents a risk to us. I know it's hard to keep up the work and the effort, but unless we do that, and what the curve is showing us is we will have more ICU cases than we do beds and nurses. We don't want to be in that position. So of all the activities we've talked about, of not going to gatherings, and even though you want to see family and share a meal, we don't want to do that. We want to do everything we can to keep that curve down, to continue the work. Let's not lose the progress, but we have more work to do. We have more heavy lifting to do. And we know what we need to do, but we just can't forget about the importance. So, JR, I think that's what my comment was in relation to.
Okay, I think we also had Aaron from Channel 29 looking to do a follow-up. Did I hear that correctly?
Hi, thank you so much. So just my last question is, we did see that there was that dignity protest yesterday. I'm just wondering if anybody has a response to that, and also if that what prompted the new order of 22 pallets of PPE to those local hospitals, or was this something that was already in the works before this protest happened?
So, Aaron, I'm not sure I understood that correctly. Can you say that again? Sorry. Let me just ask you to repeat your question.
Yeah, so we did see that new order of 22 pallets of PPE. I'm just wondering, was that in response to the dignity protest yesterday, or was this something that was ordered and placed before the protest happened? And if anyone does have a response to the dignity protest that took place yesterday?
Yeah, they're unconnected, and I'm sorry we had to ask you to clarify. We just needed to understand better. That order was placed before that time.
No worries, thank you.
Okay, if there are no further follow-ups, we're going to go ahead and close. I want to thank our partners from the media. I know this is very complex information, and we're trying to give you live, at your fingertips, data and responses. So thank you for being patient with us as we figure this out. I also want to thank Stephanie, our ALS interpreter. She's been here by herself today, and we've definitely made it challenging for her. So thank you, Stephanie, and we will see you next week. Thank you.